Hello and good afternoon. My name is Bárbara Palacios and I am the responsible of PalauMacaya. Today we are online. We are going through streaming and that's why I will use Spanish. Welcome. Good afternoon to one and all. To those of you following us from home or from streaming, we are in PalauMacaya, a reflection center that belongs to Fundación Caixa. Today we are kicking off the project co-organized with the Barcelona Supercomputing Center entitled Sex and Gender Bias in Intelligence, in Artificial Intelligence and Health. This is one of the proposals chosen in the 5th call for reflection proposals pushed forward by Fundación Caixa. The fact that we're here today involves 4 elements. First, the project has a 360 degrees perspective. It includes participatory actions. Third, it includes several social actors, and it's target-oriented. In this sense, we are sure that the reflection that we are about to kick off will contribute to a better future for us all. Thank you very much for being here. Thanks for those following us through streaming. And without further ado, I would like to hand it over to Madam Zulema Altamiro from the Ministry of Science and Innovation. Thank you very much for your attention.
Y tengo el inmenso honor de...
Well, I have the pleasure to be the first one to speak in today's meeting. I will use a very short presentation for my presentation, in which I would like to share with you the gender perspective in science and innovation, which is the area in which we work here in the Ministry. Before getting started, I would like to warmly thank the organizers, the Bioinfo program of the Barcelona Supercomputing Center. I would like to thank María, José, Rementeria, who handed over this invitation. Secondly, I would like to congratulate you for this very important initiative. Not only I would like to congratulate you for the program and the cycles that you're going to be celebrating, but also for the very program that you are pushing forward to raise awareness about the role of women in science and in science-related positions, and the relationship between artificial intelligence and health. We believe that this will be in the future one of the key areas in the future, and we need to push forward research and women's participation in the mid, in the short, and in the long run. So, as the Director of Women and Science of the Ministry and of Secretary of the Observatory for Women, Science and Innovation, I would like to share with you the main pillars and objectives we use in the Ministry for Innovation, as well as the environment in which we believe women operate today in the areas of science and innovation, as well as the main challenges that we believe we face in these areas. We are referring here to 4 pillars. We want to move forward. We want to measure, because what you cannot measure, you cannot change nor improve. It's very important to carry out a systematic follow-up on the situation when we speak about gender gap in research and development. And we need to also assess whether the measures we're implementing in terms of equality policies are working or not. The second pillar has to do with awareness raising. We need to raise awareness about referent women that need to become lighthouses for girls wanting to follow a scientific career. The third pillar has to do with transformation of the environment where science is carried out. We are aware that these environments are still hostile for many women. We know that there are still gender bias and sex bias, and many women are there, but they are not considered, they are not included. That's why we need to work for more let's say, open and diverse scientific environments. The fourth pillar has to do with pushing forward things, fostering things, because of course moving forward will take time, and that means that we need to foster things to accelerate change so that it takes less long. So how are we going to do so? Here are some examples of the research that we have carried out in the last few years. I've been in the unit for 1 year only, but a lot has been carried out. Let me list here some research and articles that we have published, scientific figures that was published last year, and another specific research aiming at the situation of researchers during the lockdown period, as well as the situation of women in the area of innovation. All this goes hand in hand with measures to raise awareness about women, such as a website called Women 2020 and the Observatory, who approved a work plan last year, very ambitious work plan last year in November. Now, I would like to give you a hint about the situation, the state of the art. When we speak about women in science, we're speaking about 95,000 women in our country, 41% of the research staff. This is above the average of the European Union, which is 38%. And nonetheless, according to our research, these steps forward are taking place very slowly, unfortunately. Where have we improved? Well, we have improved in decision making. As you can see here in this slide, 23% of women are now in decision making processes or positions. Many OPs are now led by women also. And the third pillar has to do with the integration of the gender dimension in research and development, which is precisely the framework that brings us together this evening. The framework of this conference cycles is research and development, because many projects are now part of the National Agency for Innovation, and 23% of projects include the gender dimension, and 20% of the projects that get awarded with this prize has this gender dimension integrated within. I don't wanna take much time, so I'm gonna jump into the main challenges that we have been able to diagnose through our research. The first one has to do with attracting women talent. The second challenge has to do with retaining talent and empowering women and developing their talent. The third pillar has to do with the integration of the gender dimension within the area of research and development. And in this third challenge, as you can see here, well, it's very clear that we are moving forward in areas such as engineering and technology, but there are not enough women in these areas. Only 6% of our research staff are rather women. And we know that in science there are still a lot of gender stereotypes that are having an impact on women not choosing scientific careers or research-related careers or engineering careers, not to speak about artificial intelligence. The second challenge has to do with how to retain talent, how not to leave any women behind in research careers. As you can see here, the scissors effect is still a reality today. There are more and more women that are joining scientific careers, up to 3% compared to previous years, compared to men. But at the same time, there are important glass ceilings that we need to smash down. What's behind? Well, behind the pipeline that is leaking, as you can see here in these graphs, for women, it's very complex to invest the time, the extra time that research involves. It's a disadvantage for women compared to men. Also, mobility is an element that needs to be taken into account, that sometimes poses a barrier into women's fulfillment within scientific careers. Not to speak about competition or work-life balance, gender bias in general. And last but not least, gender harassment and sexual harassment That means that scientific careers for many researchers is an obstacles career. As you can see here, there are many important differences in terms of young researchers. 76% of them in the survey that we have carried out have no family responsibilities or care responsibilities. They still start feeling this gender bias, and there's a data that really is concerning, which is sexual harassment. 8.7% of researchers declare to have experienced sexual harassment at work. The last challenge that we face has to do with today's topic. In the cycles that you're going to be reflecting here, it has to do with the gender dimension in the area of research and development and innovation. We have concluded, as a result of the research called Científicas, figures from this year. A lot has been done, a lot has been improved in many areas in the studies that are now being researched and funded by the National Agency for Innovation. Nonetheless, it's key to do an extra effort, because we are speaking about excellence, reaching excellence in science, improving a science and reaching a better quality science. And also, it's very important to make sure that the outcomes of our scientific research are not biased, and we need to make sure that science benefits society at large. And for that, and this is the key take-home message that I would like to share with you in the framework of the work that we're doing in this area, is the following. We need more awareness. That's what you are contributing to thanks to these cycles. We need empowering, we need more information sharing, so that those who need to incorporate the gender dimension in their research know how to do that. And we need to share our gender expertise, which is very much needed and timely, so that the integration is done promptly and in a sound manner. The work line that we are following from the ministry today has to do with the following. As you can see here in this last slide, we are working to reinforce, support GE structures in all areas and at all levels. We need to keep working to improve the indicators and the studies that tell us more about the obstacles that women face when it comes to a full participation in science, and we need to reinforce training guidelines and measures to reach this structural change that we all know is very much needed in research. That's it from my side. I would like to wish you a very fruitful workshop and a very fruitful cycle of conferences. All the best, and thank you very much for your invitation.
A continuación.
And now I would like to give the floor to Madam Laura Pérez of Barcelona City Council. Madam Laura Pérez, the floor is yours.
Muy buenas tardes.
Hello and good afternoon, one and all. It is a pleasure to be with you remotely. I represent Barcelona City Council. First of all, I would like to warmly thank the organizers, both the Barcelona Supercomputing Center. Thanks for all the work from your side, also in PalauMacaya and La Caixa, especially this month. This month you are focusing on the topic of gender inequalities. In Barcelona City Council, I am in charge of the portfolio of social rights. But now we've been working for many years trying to include the gender perspective in all Barcelona municipal city policies or public policies. Rather, the area that you're going to be touching upon today is extremely timely. We do not have direct competences in the area of women in science, but we believe we can contribute to the reflection, a very much needed reflection about the male-centered perspective in health and in science. We need to pay close attention to artificial intelligence, which is opening new pathways related to health and health improvement. We also need to make sure that gender perspective is cross-cutting, horizontal in artificial intelligence, related environments. Today's conference links the gender perspective in the two most relevant environments at the global level, which are artificial intelligence and health. A few weeks ago in Barcelona City Council, we presented a plan to fight the digital gender gap, or the gender gap in the digital environment, rather. We have been working on this plan in a very participatory way, including tens and hundreds of women from all different fields, including new technologies as well as from the health sector. One of the main conclusions that we have reached has to do with the need to broaden our network, a women network, to identify where we need to dig in and where we can identify more gender inequalities to, of course, tackle them. So in the press conference where we presented the outcomes of the research, we shared time with Berta Devan. She's the director of the Barcelona Women Cucut, and Elena Carreras. Elena Carreras is a PhD in medicine. She's a surgeon in Vall-d'Hebron Hospital here in Barcelona. And the Dr. Carreras shared with us some examples that prove to what extent health and medicine are still very much male-centered. Decision-making processes are led by men also in the medicine sector. She posed a very simple and practical question. She asked why a device such as a mammography device is still painful. How is it possible that surgery devices are designed for big hands, and why many women surgeons still find difficulty in finding the necessary devices they need for their work? They don't fit, right? These are some examples of this androcentric perspective in medicine that poses a barrier when it comes to overcoming gender imbalances at work. Now, if we digged in, and now I will not have time, but if we refer to sexual and reproductive health, mammographies are only an example, but in gynecology we would have a lot to speak about. I have no time. It could go on forever if I open this Pandora box. Let me share one very interesting information with you. So according to statistics, 1 out of 4 women declare having a very negative perspective about their health. This percentage is dramatic if we compare it to men. It's 15% of men. So this figure shows that gender imbalances and inequalities worsen depending on the area of health where we touch upon, such as mental health. Well, data in mental health shows that many women are over-medicalized, not to speak about social differences. Social class defines the mental health situation in all social classes. So in order to overcome this bias and this gap, we need to incorporate a gender perspective, as Dr. Carreras said in her presentation back then. There's a second area that I would like to refer to speak about now: artificial intelligence, health, and the gender perspective that brings us here. The development of artificial intelligence opens new perspectives, new pathways in many different areas. As a representative of Barcelona City Council, I'm clear about the fact that artificial intelligence is a very powerful tool. We're actually testing artificial intelligence pilot projects, and we believe that artificial intelligence today has to be put at the disposal of all human beings in order to ensure social rights of the population at large, and more especially in the fight against inequalities. I would even declare that it's one of the priorities we have as a local administration. We are close to citizens. We are experiencing a social crisis, a care crisis. Our population is more and more, the population is aging, so we need to bear this in mind. Recently, we announced in Barcelona City Council a new policy in the area of social innovation that goes hand in hand with artificial intelligence projects. Let me share a couple of examples with you. The first one has to do with ensuring social attention, social services, and how we make Barcelona City Council services more agile. Here we have launched a pilot project that aims at helping us predict and thus plan what response will be required from the person that is sharing their reality with us. So this helps taking better decisions in the decision-making pipeline to better spot the resources that are most relevant for users. And then there's a second example that has been broadcasted in the media, has to do with the personal assistant robot called Ari. This robot helps elderly living alone in their apartments, and that helps them live longer and with a better quality of life at home. Amongst some of the functionalities this robot includes, it helps us identify signals about cognitive deterioration in the elderly and helps professionals monitoring users. These are only two minor examples. Nonetheless, I would say that within the different functionalities that artificial intelligence might have, these are two positive examples, and it's very important that artificial intelligence benefits society at large and not only a few. It's very important to move forward in remote assistance for the elderly, for example, and at that purpose, artificial intelligence can help and will help for sure, but we will need to include a gender perspective to target and tackle gender imbalances and inequalities. There is another area which is key, health, and the conference is about health. We believe that the gender balance has to be included in all policies, in all actions. It's a cross-cutting area. It's one of the priorities that we have defined in Barcelona government, and we have to use that. We need to be clear on that from the very beginning of the design of our policies, not to speak about the transformation that medicine is going to experience as a result of the incorporation of artificial intelligence. Both the scientific community and public administrations need to act together, hand in hand, to avoid gender inequalities, to expand, to bridge the gap of gender inequalities in medicine. So that's why we believe this is a clear advantage, an opportunity that artificial intelligence will put on the table. The gender perspective and health shall go hand in hand. Let me conclude by saying that it's a pleasure to host this conference in Barcelona, even if today we are far away because, well, I mean, you know, it's very nice to have this conference in Barcelona, in PalauMacaya. We believe that this is a key topic, a key debate to ensure that progress in artificial intelligence and health in general will not end up widening this gender gap and posing more and more barriers and difficulties for women. We rather would like it to contribute bridging the gap. I'm sure the conference will be extremely useful. Thank you very much and congratulations to the organizers. I hope you're going to have a very fruitful conference. Thank you very much, Laura. My name is María José Rementeria. I'm the coordinator and leader of the project, of the program, Bioinfo for Women. Good afternoon, one and all. Thanks to all of you who are here live, those who are following us via streaming, those who are following us through YouTube. Thank you very much for attending to the conference and for participating to this inaugural conference of the reflection cycle on sex and gender bias in artificial intelligence, building the future of equality. First of all, I would like to thank the Fundación Caixa and PalauMacaya, as well as Barcelona Supercomputing Center for all their support in the program of the Bioinfo for Women, thanks to the unity of women and science of the Ministry for Science and Innovation, and thanks to Barcelona City Council for their support in the framework of the project. Thanks to the representative of both institutions, Dr. Zulema Altamirano and Laura Perez. Thanks for your kind remarks and words. The program Bioinfo for Women of Barcelona Supercomputing Center has been operating now for 3 years, providing support to women researchers in bio-IT and raising awareness about their scientific work. Also, and within the program, we have been leading a research line on gender bias and sex bias in bio-IT. Within this research line, we have framed the project that we are now presenting, this reflection workshop that we are now inaugurating. Today is the kick-off of the sessions, and throughout the following months, because the project lasts for a few months, well, I believe that this will allow us to reflect about human development in the area of new technologies and artificial intelligence, with a special focus on its implementation in the area of health and precision medicine. We aim at opening a participatory dialogue forum between the scientific community and society at large in order to communicate, to raise awareness on the topic and about the repercussions that the topic has in the digitalization process. Throughout history, women have been victims of discrimination on the basis of gender, social segregation, and all this in all areas of life: justice, the economy, employment, fashion, social parameters, as well as health. In today's society, as all men and women are immersed in a model that includes several sex and gender bias, but sometimes they go unnoticed. We're used to coexisting with this bias, and we don't perceive them anymore. We live in a patriarchal world adapted to masculine needs. And in this world, women, we have adapted. In order to spot this reality, in order to understand such bias, we need to look at things from a gender perspective. As the writer Gemma Lienas says, and I quote her, it's needed to put on purple glasses and look at everything from this new lens, this new feminist lens. This will allow us to understand the gender and sex bias that we accept as if they didn't exist. Unless we diagnose them and raise awareness on them, we will not be able to combat them or get rid of them. And in conclusion, we will not be capable of building a better world both for men and women. In scientific practice, well, of course, scientific practice is also influenced by the environment, and thus it's very important to put on these purple lenses to understand the accumulated bias throughout history. Today it has been proved that the impact of many diseases is not the same in men than in women. The symptoms of many diseases, their evolution, as well as the response to treatment used to combat diseases is very different between men and women, but these considerations and differences are recent. In many cases, they have not been included, they have not even been understood or studied in today's data or available data in scientific repositories. Artificial intelligence and precision medicine open a promising future, and many tools that will help us overcome problems in health, such as diagnosis, treatment, disease treatment, tailor-made, personalized for all individuals with their particularities and individual circumstances. In order to reach all these objectives, we will need to use scientific knowledge, existing scientific knowledge. But if this knowledge is used without a proper revisitation, without an adaptation to the new gender paradigm, the outcomes might be catastrophic for women, especially because all these existing bias will broaden and most likely they will perpetuate over time in the system. So in the different work sessions that we're going to be organizing from now until the summer, we'll be opening a debate and we will carry out an analysis about the implications and the impact that this situation might have on human well-being. We also want to explore new feasible solutions to come up with different ways, different mechanisms to implement solutions based on artificial intelligence, a reliable and transparent artificial intelligence. To conclude my remarks, let me focus on the reflection about the gender bias, the existing gender bias in the area of digitation. We are in a process of digitation, and the COVID-19 crisis has accelerated digitation. I believe digitation has to be understood as a process to contribute to a better future, and of course an opportunity to build a better future, a more balanced future for men and women. For this, it's essential that us women participate and raise our voice and participate in all the process, including the leadership, the design, and the implementation of processes. Thus, it's very much important to ask girls and young women to join us and to choose scientific and STEM-related careers. STEM means science, technology, engineering, and maths. Unless they participate in the STEM world, the digital world of the future will include immense sex and gender bias, and us women will have to keep adapting to a more and more patriarchal and masculine-oriented world, and we will all have lost an amazing opportunity to build a fair world. I would like to give the floor to Nataly Buslón, who's going to be presenting the different cycle sessions and how it's organized. Nataly, the floor is yours.
Sí, está la presentación. Ahí está. Okay. Bueno.
Hello and good afternoon. One and all, it is a pleasure to inaugurate this cycle. I'm a researcher of the Barcelona Supercomputing Center, and the conference, of course, is about sex and gender bias in artificial intelligence and health. I would like to join the remarks of María, José, Rementeria. I would like to thank Fundación Caixa, Barcelona Supercomputing Center, as well as all those who have supported us in the design and implementation of the cycle of the project. And I would like to thank also all the participants to the conference from different parts of the world. Thank you. Thank you very much for being here. So, the cycle of conferences, as it has been said, has to do with the program Bioinfo for Women, led by the Barcelona Supercomputing Center. The main aim of the sessions has to do with opening towards society. We want to open an interactive debate with society at large. That's why we are aligned with the Sustainable Development Goals, SDGs, and the SDG on health and well-being, gender equality, and bridging the gap and today's inequalities. It's important to underline that Article 27 of the International Declaration of Human Rights says that us human beings have the right to benefit from scientific progress, having access to the benefits of science. So it's key to have forums as this one to work in order to build this bridge between reality and Article 27 of the International Declaration on Human Rights. The structure of the program is as follows. We have designed our research line, or we have made it simultaneous to our research line. There are two blocks. One has to do with personalized medicine, and there's another block on ethics, society, and artificial intelligence. So that, as it has been said, well, these are the two main axes of the cycle of conferences. We're going to be hosting two conferences. Today is the inaugural, the closing conference, but also in each block there will be one workshop and, one seminar rather, and several workshops. The cycle starts now in March and it lasts until June the 16th, 2021, that is. So let's get started. In order to, well, we are going to be listening from Professor Alfonso Valencia, professor of the Supercomputing Center on Life Sciences. He's the director of the National Institute of Bioinformática, or Bio-IT, Elixir, Spain, and Dr. María Teresa Ferretti. She's the co-founder and scientific director of Women Brain Projects. We work closely with them. And in order to start with the following conference will be on April the 14th. You are almost welcome. That session will focus on precision medicine and more specifically on health. And for that, we'll count on the participation of Professor Luis Rocha of Indiana University, Carmen Baez, the director of the program Women, Health and Quality of Life of CAPS, a national referent that would be, and the researcher on mental health, and Dr. Silvina Cataluga. That will be on April the 14th. This section will be followed by a workshop with the participation of researchers that will follow the design thinking methodology in order to think and reflect about what has been said in the seminar and work on the cycle objectives, the PalauMacaya cycle objectives, and this will be part of the final outcomes of all this list of workshops. The second cycle will focus on ethics, society, and artificial intelligence. In that framework, we will count on the participation of Caterina Gilbert, PhD of UPF, the co-director of the bioethics and rights Itziar de la Cuona of Barcelona University, as well as Paula Petroni. She's a researcher and professor in IES Global. Last but not least, the inaugural conference, the closing conference rather, which will be on June the 16th. Well, we will read the main conclusions of the cycle of conferences. We'll be presenting the main outcomes, as I said before, and we will count on the participation of the Deputy Director of the Barcelona Supercomputing Center, Giuseppe Martorell. We'll also count on the participation of the researcher of Stanford University, Madame Schigenberg, as well as Catherine D'Ignazzi. She is a professor in MIT and director of Data Feminist Lab. So without further ado, let me invite you all to participate in all the cycles in the different modules, be it here, live, or via streaming. Let me also tell you that you can follow us through our Twitter and LinkedIn profiles, as well as through the PalauMacaya website where the program is described. Any comment, any idea that you would like to share with us, do not hesitate. Last but not least, let me say that throughout all the sessions you will have the opportunity to ask questions and share comments. Also, if you're following through YouTube, there is a chat box, streaming chat box in the YouTube channel, and we will of course allow you to ask your questions wherever you are, here live or remotely using a platform. Thank you very much for your attention. And now we will hand it over to Professor Alfonso Valencia for his presentation.
Bueno, buenas tardes.
Good afternoon, one and all. Thank you very much. Thank you very much for being here, live or online, and thank you very much for having invited me to share a few reflections. I represent the Barcelona Supercomputing Center, and I believe that the topic at hand is extremely concerning and interesting. Let me start by a short presentation. Barcelona Supercomputing Center is a national infrastructure today. We are a European infrastructure. We host a supercomputer, a Maelstrom 4. So soon we'll have a Maelstrom 5. The investment is a shared investment between the Spanish government and the European Commission. The investment is 230 million. That means it's a very important investment. We're also a research institute. We have 870 scientists and engineers. So we are one of the largest research centers at the Spanish level. The BSc is organized in 4 departments. The Earth Science Department for climate change studies and weather forecast studies. In fact, all the weather forecasts about the Saharan dust that invaded Barcelona came from the Barcelona Supercomputing Center. We have an engineering department. We have also a computer science department that aims at proving, or rather developing, hardware and software at different levels. We have a life science department, the one that I direct or chair. We have 230 scientists working on life science related domains. What is the problem that we face? We have amazing capacities such as Mare Nostrum we have amazing capacities in terms of software and artificial intelligence development. But the problem we all face, or one of the problems that we face on our daily basis, has to do with this graph. Well, this graph is typical. This data comes from the largest scientific institution of the country. This is our stature graph. We have more and more women choosing science careers, but throughout the years, only 26% of women become research professors. So there's a phenomena that is clear. There's a second graph which is even more concerning. This is the number of men and women in the different departments of the Barcelona Supercomputing Center. If or as, well, in areas such as life science, in my department, there's almost a gender balance, but in earth science, 72 versus 37, but when we get to engineering, the problem is dramatic. 251 engineers versus 25 women engineers. So it's difficult to overcome the situation. Let me say that this is not only the case of the Barcelona Supercomputing Center. If it was only us, it would be easy to solve. This is a general problem. This is a global problem in the area of engineering. The more hardcore engineering becomes, the less women we are capable of attracting, or the larger the imbalance is. Nonetheless, it's very difficult to have these 251 engineers to be concerned about gender bias problems, because of course they are, I'm sure they are, but as a group, our target, let's say, has to do with other areas, and for sure it's impossible to act in a balanced way when we have only 37 women. And this is nothing, special from our colleagues, right? This is a global problem. This is a global problem that we all have to face, and that is going to have a horrifying impact on us all, because they are the ones that are going to be implementing the hardware and the software of the future, and thus we'll have a gender bias in the hardware and the software of the future. We have a problem. That's a fact. That's why we decided that with María José Rementeria already told you, in the unit for social impact assessment, we decided to come up with a program called Info for Women, aiming at solving this problem by supporting young girls who are in the transition process, in the postdoc transition towards a PhD process. So we decided to organize activities such as these workshops in order to attract more and more women to push forward women's career. And we want to use our analytic capacity to understand a gender bias, or the gender bias perspective, from a scientific perspective, right? Which is also important, because of course awareness raising is key, but at the same time we need to carry out scientific research about what is going on with gender bias. Okay, having said that, amongst other things, in collaboration with the Women Apprehend project, we have published several articles. I would like to underline this one. In this article, we have assessed gender bias related problems in different scientific areas, and we have split it by 2 categories, or through 2 different categories. Desirable gender bias and patterns that are totally undesirable. Desirable bias would be those that involve understanding men and women problem separately, right? Because there are some areas that affect physiologic elements, and of course this has to do with medicine. For example, it has been said in previous presentations, men and women problems when it comes to health cannot be dealt from the same angle. So we need to include this desirable bias in research in order to preserve what's scientifically reasonable. On the other hand, we have undesirable bias, and we'll be focusing on this undesirable bias. These are bias that we end up promoting when we are not careful in training our machine learning systems, and we end up coming up with biased methodologies, outcomes, and softwares that end up discriminating women by not taking into account the data composition, and thus we are somehow producing undesirable bias without even knowing. Let me give you a couple of classic examples and widely commented about the main consequences of introducing bias, gender bias in data lakes or data bases. This is in this exercise we asked, by looking at this picture, who is carrying out these activities. If we ask the software who is cooking with this kitchen, with this picture, the system will answer it's a woman, because the system has been trained with Google Pictures, and Google Pictures, when it comes to cooking, it displays women. So no matter whether you have a man or a woman cooking, the system will, let's say, be biased and will always display a woman or say that it's a woman cooking. This has a technical solution. I'm not going to get into details now because I have no time, but we can create a forum or a space where women and men representation is balanced, so that when we map a knowledge such as cooking, well, the answer is less biased or not biased at all, and this happens in an environment that is balanced. So there is a technical solution to overcome this problem. There is a technical solution also if we are aware of the problem only, and if we want to solve it, of course. First, we need to be aware. Secondly, we need to have the will to solve a problem in order to think about technical solutions. Let me come up with a second classic example, which has to do with translation. So we use a word, a sentence that includes a gender. She is the president. And now this sentence is translated into a language where president has no gender, Turkish. And the system says he is the president. So you start with she is the president, and you end up with he is the president, because it's more common that MPs are men than women. This problem has a solution, and actually Google has a solution which is rather cheap, which is having a label, a gender label in this automatic translation system, so that when this word is used again, there is this label that informs about gender. This is not a very expensive solution, easy to implement, but of course you need to have the will to implement it and being aware of the need to do so. What I mean by that is that there are technical solutions for bias-related problems in the area of artificial intelligence, in this case, image detection or automatic translation. Things become a little bit more tricky when, well, in these cases it's rather easy, right? Because there are big learning compounds and you can rebalance data. The problem is when you get into areas where data compounds are much more complex and less expensive. There's a collaboration between the Barcelona Supercomputing Center, hospitals in Madrid, the Clinic Hospital in Barcelona, and the 12 de Octubre Hospital to predict the evolution of COVID-19 when a patient is admitted to the hospital, obtaining his or her data and predicting whether the forecast is better or worse in order to intervene and avoid complications. So we train neuronal networks, and it works pretty well. The problem is, the problem is that data is difficult to understand and assess. Here we're speaking about data coming from different hospitals, so the population they refer to is different in terms of age. For example, between these two, Hospital 12 de Octubre, for example, for sociologic reasons, those who are admitted into the hospital with COVID-19 are much older than those being admitted in Madrid hospital. This is a sociologic reality, or the other way around. It doesn't really matter in this case. So gender distribution is different between both hospitals, and here we find some important problems. If we want to train a system to predict correctly the evolution of a COVID-19 patient will have to pay attention to sex differences and age differences. So sometimes it's not only about having the will to, but also about having the necessary information and having the methodology to solve complex stratification of data and preserving the balance, because the solution is never easy, or not always easy at least. Of course, many of the problems that we face, unless we are capable of having, as Maria Jose said before, of having a new perspective, a new lens, we'll never realize that we are in trouble, because if we don't look, we don't feel, right? We don't spot the problem. This data comes from American records, the medical reports rather, in Indianapolis, in a city in Brazil, and in Catalonia. So we are comparing 3 different societies, 3 medical institutions that are completely different. So the outcomes are not going to be by chance. There's going to be coherence. What we are asking here is how many drugs that are not, let's say, desirable to administer together are being administered together. In some cases, there's no other solution, right? But in other cases, it's a matter of lack of information. So sometimes if you don't admin the drugs, the danger is dramatic, and data is also dramatic. Let me insist on that. So we're administering pairs of drugs that are recommended, but in men, the pattern is rather small, 1.3, 1.7. So there's no pattern, whereas in women it's 1, 34, 35, and 14. It depends on the disease we are trying to understand. So co-exposition to drugs affects women much more largely than men. And this was unknown until quite recently. We need to understand why at some ages this gap is larger than in other age frames. We need to understand each case, and we need to understand the typology of drugs as well, of course. So this is complex analysis. The problem of the sex bias in medicine is a reality. It has to do with the medical clinic practice, and in many areas, such as in pharmacology, I believe that we lack awareness, we lack consciousness, and we lack information about the massive gender gap between men and women. We're not always in this position of gathering so much information and carrying out complex research. This is one of the most widely used data in biology. It gathers information on genic organisms, or genic information about organisms rather, and the technical data and how the data has been obtained and gathered, how samples have been treated. Well, all of them are properly labeled, but in terms of gender and sex, very few data is labeled. Only 20% of the data is labeled, and this is mouse-related data. So if data is not properly labeled, there's nothing we can do to better understand differences between men and women. So there are problems such as the automatic translations, where we have data, where we have information, and we have the remedy to avoid the bias. But there are areas where, unless we design things from the beginning in a way that is not gender biased, or it will be impossible to use the data in a non-gender biased way. So the community, the scientific community, is concerned about this reality. This is Elixir, the European Network for Biocomputing, and here are some recommendations about the different methodologies that artificial intelligence should use for them to be acceptable from an ethical perspective, as well as from a technical perspective, so that we can issue recommendations for the specialized magazines. We shall say, don't publish a study unless it fulfills all these criteria. And this has become today quite widespread. There are some recommendations called FAIR that ensures that data is traceable, interoperable, and well, we need to make sure that we add another criteria, which is gender aware. Data shall and must be gender aware. This is the main practical lesson that we all should gain, and we need to make sure that we move from considering data and methodologies to be usable and open and reusable, etc., but also non-gender biased. These are only technical categories. They need to be gender aware. They need to be properly labeled in terms of gender. They need to be proportionally distributed, and they need to be capable of representing gender differences. We need to add the fair label, the gender aware label as well. So I'd like to conclude with a couple of slides on personal medicine. There's a very clear example, a scientist, a science disseminator that says that artificial intelligence in medicine produces or will produce or shall produce a liberation of professionals so that they have less time for bureaucratic burdens and more time for patients without having to assess all the data that will be done by artificial intelligence mechanisms. He also says that medicine is one of the areas of human knowledge where less systems are being used to help professionals take sound decisions. So one of the missions of artificial intelligence in the area of personalized medicine has to do with providing professionals with tools to take better decisions, to ease decision-making processes, and spend more time with their patients instead of being in front of a computer. And this works very well. These tools prove to be extremely useful. These are systems, these are AI systems to scan X-rays that have been approved or that obtain better scores than humans, than doctors. This is not surprising because machines are much more capable of assessing and evaluating thousands of images than humans that end up being distracted and making mistakes. So these are BSc implementations in the area of image medicine. It's easy to move forward, but of course we need experts to solve problems in the area of in vitro fertilization or tumors detection. This area is moving forward sustainably. More and more one can say that artificial intelligence is improving in machine learning and in data processing. Nonetheless, this area of artificial intelligence is moving at the speed of light. Probably it's evolving in a disruptive way with new methodologies, with new ways of understanding things continuously. This comes from DeepMind. DeepMind is a Google company. Probably it's the most advanced company in the area of artificial intelligence. They solved the chess problem first and others. We've reached a point in history, and I believe that this is a point we should reflect about during these workshops. Well, we've reached a moment in history where our aim has not to do with coming up with systems that are capable of better predicting or playing better chess. We need to come up with systems that are intuitive. The director of DeepMind says that he's interested in problems where the key element is imagination, the key element is intuition. In his example, he says that, well, we need to come up with systems that are capable of playing on the basis of strategies, intuition. They have come up with the best system to play Go because it's a system that better uses strategies and intuition. This is move 37 in the famous game against the world champion. All of a sudden, the artificial intelligence player made a move that surprised all players, and it's still discussed because after 4,000 years playing Go, no human had ever used this strategy. And this will have, of course, a very important impact in biomedicine-related problems, where problems are not closed anymore, such as the Go dilemma, right? Where you end up knowing if you have won the match or not. In this case, the article that was published by The Guardian and La Vanguardia at the end of last year, DeepMind opened a biomedical problem, the prediction of proteins. Our drugs act against protein, right? And it has solved a problem, right? And it's not a closed problem, it's an open problem because we never know about proteins as structures. So they came up with a solution on a problem that many of us have been working for 30 years. This example is the coronavirus of 3A protein. There are two colors, blue and green. One is the real protein, and the other one is the predicted protein. They are not distinguishable, so AlphaGo, a Google company now, can predict the protein structure much quicker than in experiments, and they can contribute thus in the fight against coronavirus as well as many other diseases by carrying out these forms of a structure, and this opens very interesting reflections for the upcoming weeks. What impact will this have on the world of art, of medicine? What problems are we going to be capable of solving through DeepMind? How is it possible that a Google company can get there and not the public sector? We're less efficient, right? What sense does it make that DeepMind can now collaborate with pharmaceutical companies better than us from the public sector, because we have no machines like DeepMind? Is it positive? Is it negative? It's important that they've done so, but we need to be careful because there's ethics, and there's a matter here that has to do with the debate between public and private science. Let me conclude with the following statement. Artificial intelligence is here to stay. It's the area that is moving forward the fastest. There are important disruptions in all areas. In biomedicine, probably is the area that is moving forward the fastest in the area of AI, but these methods are not easy to implement. This is a career related to methods in an algorithmic scale. Since 2013 to 2019, we have moved through 10 orders of magnitude in the capacity, in the computational capacity required to train the systems. So today we have a major problem. We have the problem that in order to be competitive against Google, we need a computational capacity, which is just crazy. This is a statement of Maite, who is one of the group leaders of the language processing in the BCE. She says that this is crazy, that they don't even know that if the BCE is going to be capable of competing against Google. -4 is at the limit of its capacity. It's 4 years old, and it's impossible for them to keep training artificial intelligence models because they need more computational capacity. Of course, we'll have a new computer, our Maestrum 5, with new theaters, 15 times more capacity, computational capacity, and this will provide us with the possibility of keep working for the next 2 or 3 years maximum. We'll be able to maintain our competitiveness, but this is a fundamental race. Unless we have computational capacity, will be at the hands of private companies that, of course, buy this capacity, develop this capacity. So amongst the many areas that we will have to reflect about in this artificial intelligence debate has to do with the race of computational capacity. We shall never leave it at the hands of private companies only. Let me conclude with a short reflection about the medicine of the future. We have this data, we have large amounts of data, collaborations with hospitals, we have enough machinery, the Marenostrum 5, the new artificial intelligence methods, etc. With that, we want to go towards an environment where, and this is the main example that I'm sharing all the time. This is Anna, who is a problem, a condition. She's had an accident and she has a disease. She attends her health center where more and more data is collected from her about her genome, her metabolome, images, microbiome. So all this information is continuously sent to the virtual world, to the virtual Anna, to Anna's digital twin who lives in a computer where experiments have been carried out. Experiments that cannot be implemented on real Anna, and now with the available new information, new simulations are available to try and respond to real Anna's condition and situation. Several responses are sent to the real world where the real Anna and her medical team will have to take decisions regarding potential therapies, lifestyle, or others. So of course we're not yet there, we're far from these virtual twins, but I believe that this is the path forward. This is the path we must follow, and this is the path that we will end up having to go through in the upcoming years. More and more we will come up with these virtual simulations of medical systems that are used to inform decision-making processes. The example here is about Anna, deliberately about Anna, because we need to be really careful and we need to make sure that the example, or rather that the system also benefits women, not only men. Let's make sure that these systems are not only beneficial for men or unbalancedly beneficial for men, based on this horrifying bias that we are so used to today. Thank you very much, and I'm very happy to answer to all your questions. So the Q&A session will be at the end, if you don't mind. Thank you very much, Professor Alfonso. Now we will give the floor to the next speaker, Maria Teresa Ferratti, who is with us via Zoom. Thank you very much, Maria Teresa.
Buenas tardes a todos y todas. Good evening, everyone. It's a pleasure to be here. I would like, first of all, to thank the organizers for this very kind invitation. I'm delighted to be representing the Women's Brain Project at this very important occasion. And I would like to thank the Bioinfo for Women initiative, of course, the Barcelona Supercomputing Center, in particular, our long-standing collaborators, Professor Alfonso Valencia, Davide Cirillo, María, José, Rementeria, and Nataly Buslón as well. So thank you so much for this invitation, and I'm going to share my slides. Right here. What I would like to do in the next minutes is to give you a little bit the perspective and the vision of the Women's Brain Project, which is a non-profit organization I co-founded in Switzerland, and I'm currently the Chief Scientific Officer, which focuses on sex and gender determinants of brain and mental health as a gateway to precision medicine. And what I would like to do today is to give you an idea of how pervasive and prevalent are the sex and gender differences in health in general, how important they are because they are actually an opportunity that we can leverage to implement precision medicine, which in my opinion is the most important innovation that we will have in medicine in the future, and how crucial it is to implement precision medicine to use artificial intelligence and novel technologies, but we have to do it right. So I will urge everybody who's listening to understand that we have a historical opportunity to do something that will really benefit the society in the future, both men and women. And we have now the responsibility to have these discussions, have these conversations, and try to do it the best possible way, avoiding all possible biases. So let me start with a consideration about COVID, and this has also been mentioned by Professor Valencia. I think this has been a huge tragedy that we are all experiencing since more than 1 year. And at the same time, within this tragedy, I'm trying to be optimistic and to see that actually we might have opportunities for learning lessons. So I'm a scientist, I'm a neuroimmunologist, I'm very curious about how the immune system works, medicine in general interests me. So like most of my colleagues, when COVID started to read papers and start to try and understand what was happening. And one of the things that really struck me since the very beginning, and it's still there, and I'm sure everybody in this room can agree, is that actually there is so much variability in the way this virus strikes and infects. So first of all, you might have a family with one person that is sick and has the virus, and for some reason, some people will be infected and some others not. We still don't understand why. And then two people who are both positive, you have all sort of, all the possibilities in the spectrum of possibilities, right? So you have some people who will be asymptomatic and don't even notice that they have a virus, and some people that will actually have very severe pathology and will require hospitalization and even intensive care unit assistance. So extreme. And since the very beginning, I thought, this is really a very interesting point from a scientific point of view, but from a public health point of view, this is the key. If only we could understand what are the specific characteristics of the people that are more likely to be infected with the virus, we could implement proper measures to avoid and to limit the spread of the virus. If only we could predict who will go on to develop the most severe phenotype of infection, we could actually plan all sorts of measures, public health measures, to reduce risk and to protect those people and to follow them and to have proper therapeutic plans already for them. So this is a really interesting aspect, how variable and the variety and the importance of individual characteristics in understanding this pandemic. And I think this is still a very pressing need. We are not there yet, even though there are a lot of efforts in this direction. So when I was reading this paper, one of the things that caught my attention at some point was actually these sex and gender differences. And it was more than 1 year ago that we started to read papers that were coming from China. One representative of Women's Brain Project was actually living in China back then, and so she was very well aware and abreast with the literature. So the first case reports and the first studies started to come in. We were reading them, and I immediately noticed, even in the very first one, it was a small study, and yet in this study, most cases were of infected people were men. And it was very clear that men were also dying more often of the virus. So that's the first time that I said, but is it possible maybe there is a sex difference here, and sex, biological sex, is one of these individual characteristics that can affect the progression of the disease? And actually it turned out to be yes, because then in the month that followed, we have been studying the literature with the team at the Women's Brain Project, following data from Spain, from Italy. I come from Italy, from all the countries that were making this data available, and were stratifying the data by sex. And it became quite clear that that was exactly the point. And just to show you aggregated global data at the global level, what we are seeing right now with the current knowledge that we have, and I don't know if the variants will show us any different picture, but the picture we have right now is that the infection rate is actually the same between men and women. We don't really see differences in the number of infected people at the global level. However, the difference that we see is really, is really in the severity of the disease, the ICU admissions, and the deaths that are affecting more men than women. And this, I mean, this was quite something. It's still something that we are talking about, we are discussing in the scientific community. It is clearly one of these factors that we were talking about. Of course, there are interactions with a lot of other conditions, comorbidities, socioeconomic considerations, but still it is quite a significant effect. And so I think this has put the kind of a spotlight on these topics of sex and gender differences on the global agenda, because now everybody is looking at this and is saying, wait a second, is it possible that the same agent, so we are talking about the same virus, having completely different effects in different people and having completely different effects in men and in women, that the response is so different. And I'm hoping that this will actually start a conversation at the global level where people will start to understand that actually these differences are basically everywhere in health and medicine. So is it really only COVID at this point that where we see these differences, or is it also in other pathologies? Actually, first of all, it's not just COVID, it's a lot of viruses that we know of. And also previous similar viruses had shown the same pattern, like SARS and MERS. They had also a higher severity in men. So this is something that we already knew. It's very well known to the people studying gender medicine, studying these differences. But it's really not just for infections. These differences are everywhere. And I would like to give a couple of examples. Cardiovascular diseases are a very good example. We tend to associate cardiovascular disease to men. The typical picture we have is a man having a heart attack, which is true in certain age ranges, but actually cardiovascular disease is the major killer, the #1 killer of women in both the States and in Europe. So after menopause, actually women are at very high risk of getting this type of diseases. And not just that, it's been shown that the symptoms of having a heart attack are different between men and women. So there is a movement in the cardiovascular field to actually educate doctors, especially in the emergency room, to be able to recognize these different symptoms, because historically, unfortunately, many women have been sent home because they had very vague and generic symptoms. And so the doctors thought they were having a panic attack, or, you know, it was just anxiety, and it turned out that they were having a heart attack. So very important sex and gender differences, very relevant for diagnosis, for instance, but also treatment. There is also evidence that the type of treatment that men and women receive and the outcome of this treatment and the complications after treatment can also be different between men and women. Another example that is very close to my heart because it's related to brain, and with the Women's Brain Project, we focus a lot on brain pathologies, is anxiety and depression. And these are mood disorders. These are extremely prevalent disorders. According to the WHO, 1 every 3 people in the entire world at some point in their life will suffer from these disorders. And of these people that will suffer, actually 2 out of 3 are women. So there is an overwhelming representation of women in this group of patients. And it's not just that, it's also that women and men show different symptoms again. So it's particularly hard to diagnose depression, for instance, in men, because they do not show the typical symptoms that doctors are trained to recognize. Men very often show aggressivity, they're aggressive, they start to compensate with alcohol or substance abuse, they start to take risk, they have a different response even though the pathology is the same. So once again, extremely important to know these sex and gender differences in the way the pathology presents itself to be able to diagnose it and to treat it properly. Even treatment with antidepressant has been shown to have different efficacy levels in men and women. And finally, the disease that actually is closer to my heart, which is Alzheimer's disease, that is my main expertise. We have, as the Women's Brain Project, been studying sex and gender differences in Alzheimer's disease, which is the leading cause of dementia in the elderly. For many years now, we have published extensively. We are publishing actually a book with Elsevier on this topic to compile all the evidence that we have been accumulating in the past years. And the picture we are having is, we are starting to put together is quite interesting. So in Alzheimer's, you have that 2/3 of patients are women, 2/3 of the caregivers, so the people who dedicate their life to support these patients, are also women. So many people call it a female tsunami, basically. It's overwhelmingly impacting women. But that's not the only aspect that I think it's interesting. This is very important to consider. But even more interesting, in my opinion, is the fact that men and women present differently with the pathology. They have different symptoms, different risk factors, different progression of the disease, even some indication of different response to treatment, especially with an interaction with genotype. So this Alzheimer's is again another example of a disease where understanding these specific differences and the specific characteristics of men and women might actually help us to get a better diagnosis and better treatment and better prevention. But we are still far from this. So the question is really, what have we done until now? How much has medicine considered the sex and gender factors when developing drugs and developing novel solutions? So where do we stand now, basically? This is what I would like to show to you. And to be honest, there isn't much that has been done. There is a lot of work to do. So the first thing that I want to show you is evidence from animal models. So we are talking about preclinical studies. An example on pain, neuropathic pain and chronic pain, for instance, back pain. This is something that affects, again, overwhelmingly women. And you'd be surprised, but actually the animal models that are used to study these diseases, to study the molecular mechanisms of these disorders and to identify new targets for drugs, actually the animal models that are used in the literature are, for the vast majority, mice, of course, and male, mice and rats, but mostly male, more male than females. There is a temporal trend, things are improving, but it's still mostly males. And even the studies that include both male and females, a lot of them do not stratify the data by sex. So they just pull all the data together. And at that point, it becomes impossible to know whether a certain pathway or a certain drug works the same in the males and the females. And I can guarantee you that actually it does, it happens. So we have a problem in the preclinical development of drugs. We have clearly a problem also in the clinical development of drugs. This used to be especially a problem in the past. Here I'm showing you a visual that wants to summarize the results of a report that was published in 2001, the so-called GAO report. This report analyzed drugs that were withdrawn from the market and was done in collaboration with the FDA. And so there were 10 drugs that had been withdrawn from the market. And out of these 10 drugs, 8 were actually withdrawn because of severe side effects that affected more women than men. So drugs that had to be withdrawn from the market because they were not safe enough turned out, the vast majority of them turned out to give issues, bigger issues in women than men. Why? The problem was that in the past, in the previous years, a lot of drugs had been developed without including women in clinical trials. And that was actually a regulation of the FDA for a very long time. And it was meant to protect women in fertile age from potential effects of drugs. This, of course, was meant in a positive way. So women were not included in these clinical trials, but it backfired because in the end, it created a gap in our understanding. So we did not know the safety profile of these drugs in women. And unfortunately, we found that out only at the pharmacovigilance stage. And so some drugs had to be withdrawn or adjusted in their dosage. So this has changed. The FDA has now completely different regulations. So there is an increase in the involvement of women in clinical trials of drugs, but it's still a struggle. So we are not there yet. And it's a crucial consideration for development of new drugs. And another example that I like to share with you was actually mentioned by Professor Valencia as well, was one of the 3 cases about drug-drug interactions. I also think this is a very clear example of how important these sex and gender differences are. So this was a small town, a town in Brazil, Blumenau, where they had access and the possibility to analyze electronic health records of the whole population. And the goal of this study was to analyze drug-drug interactions. So they could actually check what drugs were prescribed to what person. And they could analyze whether drugs were prescribed at the same time, drugs that are not supposed to be taken at the same time, because there are interactions that can cause severe side effects. And so this type of analysis of dangerous drug-drug interactions in this town highlighted that women actually had almost double the risk of men of being dispensed, so being administered drugs that had some dangerous drug-drug interaction. So this shows you how powerful digitalization can be, because you can pick up something that you would have never been able to recognize without technology. And at the same time, it highlights that there is a fundamental issue in the way we are even prescribing drugs, because we are not keeping track of who is receiving what. And in the case of women, this seems to be a particularly important problem we need to address. So how do we fix this? What do we do about that? And our message from the Women's Brain Project is that we need to move from a shallow medicine approach to a precision medicine approach. What do we mean by that? What is shallow medicine? This is an example, and it's taken by a review. Actually, the definition of shallow medicine comes from Eric Topol. And this is just an example that I would like to give you of 10 drugs that are bestsellers, let's say, in the States. If we take any of them, for instance, Copaxone is a drug that is given for multiple sclerosis. Now, the point is that out of, I believe, 16 people who are given this drug for treatment of multiple sclerosis, actually only 1 is blue. You see it here, all the others are red. And what it means is that it's only 1 person that is having a clinical benefit of this drug, while the others are taking the drug, the country or their insurances are paying for this drug is not working and is most likely giving them side effects. So we are having here an example of shallow medicine. We have a disease, we have a patient, we try and give a drug and with a trial and error system. We see if it works. If it doesn't work, we try with the next drug and so on and so forth. And this, if you think about it, it's actually not a sustainable model of medicine, because you have a huge amount of cost, of course, medical cost of drugs that are given to people that do not benefit from it. Actually, you have the human cost, the safety consideration, because you're actually giving drugs to people that cannot benefit from it, but they might have side effects from it. Some drugs might even be withdrawn from the market because of side effects, but then actually some people might benefit from them and some others not. So even that is, in our opinion, a waste of investment of money that has been put into the development of this drug. And then by not understanding which patients can benefit from it, it's actually making the whole system, again, shallow medicine and unsustainable. So what is the opposite of shallow medicine? Precision medicine. This is right now is a hype word, and I would like to spend a couple of minutes to talk about it because this actually exists and it's already implemented in oncology. Precision medicine has the goal of giving the right drug to the right patient at the right time, which sounds very ambitious, but actually it is done in some branches of medicine, for instance, oncology. And one example that I want to bring to you is breast cancer. And this is an example that is very dear to me because it's actually something that I experienced firsthand, and I can really testify to what it means to have precision medicine as a patient. So in the case of breast cancer, even though if you can have two women that present with a lump in their breast that is even similar, the idea of the doctors and the experts right now is that there are no two breast cancers that are identical. Every breast cancer is different. And how do we know that? Actually, we know it because we have come up with a number of biomarkers and indicators by molecular profiling that allow us to characterize each individual tumor. And we're looking at expression of certain proteins and receptors, certain genes, of course, the size of the tumor, a number of other clinical measurements. And all together, all this molecular and very deep profiling of the patient and the tumor allows the doctors to characterize and to identify subgroups of patients. So to identify specifically to which subgroup of patients that tumor belongs. And once you know what is the subgroup, you can actually tailor the treatment based on that. So in my case, I had a tumor that was expressing receptors for estrogen. And so in my case, it was indicated the use of tamoxifen. This is one example. At the same time, these markers, this analysis can also be done to predict side effects and efficacy of drugs. Another example, again, done on my tumor was actually a genetic analysis that allow the doctors to define that in my case, I would not benefit from chemotherapy. So chemotherapy really used to be the blanket treatment that any breast cancer patient would receive, let's say 20 years ago, and you can imagine how devastating this was. And now we are in the position to tell each patient how likely this patient is to respond positively to chemotherapy, and so to spare a number of patients for this type of treatment when it's not needed. Of course, if it's needed, you have to do it, but in many cases it's not needed. And thanks to this genetic profiling, we're actually able to predict that. So it's an incredibly powerful tool that allows you to really provide the right treatment to the right person at the right time, decreases a lot the cost of medicine in the end, because it increases the efficacy of treatments, the quality of life of patients, and reduces the side effects. So it's really an investment that is worth it. So we should really have it in every branch of medicine. And this is a little bit the message that we give as the Women's Brain Project. But to be able to do that, we need the capability to analyze massive amount of data and to make sense of a lot of complex multidimensional data set. Especially I'm thinking for brain diseases, for instance, for Alzheimer, we would need to look at, to characterize the patients based on biomarkers, imaging biomarkers, genetics, epigenetic, gut microbiome, but also demographic factors, sex and gender, socioeconomic status, a number of different parameters. And so what's exciting about this is that actually for the first time in the history of medicine, we have the tool to actually do that and implement that, because we finally have this extremely powerful artificial intelligence and digital solutions for health. So we can analyze this data and we can try and make sense of them. So now is the moment of history where we actually can do that. And another way in which digital technologies and digital solutions for health will revolutionize medicine is, again, in the context of precision medicine, is digital biomarkers. And this has also been mentioned before in the context of dementia and cognitive decline. But I would like to spend a couple of minutes on this because I'm very excited about this development. one of the most exciting trends in the field of Alzheimer's disease is actually the use of digital biomarkers to track cognition. And the way you normally do that, to track cognition, to understand what's happening to your memory and cognitive function, is to do some neuropsychological tests that you have to go to a clinic and take the test with pencil and paper, and then, you know, that's it. It can be a good day, it can be a bad day, maybe you are a little bit low with your mood, and that day you have a bad test, and that's it, pretty much. But actually we are having a surge of tools, especially apps. So really apps that you can use on your phone or your tablet that can allow you and can help you to do this type of assessment. And I really believe in this, because if you ask me, I'm sure that if my phone could talk, it would be perfectly able to tell you how my cognition has been in the past year, the days where I was down, the days where I was up, how my mood was going, and all that, just by the way I interact with the different functions of the phone. So I think there is a huge potential there, and we have apps, and this is a visual that would just like to give you the idea of what these apps can do, that have been published, actually. Digital apps you can use on your tablet. You run a number of assessments with this tablet, and the app can actually predict the progression to mild cognitive impairment and Alzheimer's disease with pretty good performance. So we are getting to the point of having digital biomarkers for even diagnosis and prediction of a disorder. So this is fantastic, it's absolutely amazing. So what's the problem now? Because it can't be all so perfect. The point is that we have to consider the sex and gender differences when we analyze this data and when we create these apps, and whenever there are data, health data involved at any level. And this is, again, a visual that I really like, was created by an artist that is part of our group, the Women's Brain Project, María, and wants to give you the idea of what's the challenge and what's the risk with artificial intelligence and biased data. So we are feeding a system, we are feeding an artificial intelligence with data, and this artificial intelligence here looks like a baby that is reading books and is learning, right? Is acquiring information. So what we are doing right now is actually providing information that is not complete. If you notice, the books have kind of holes, they are missing pieces. And this is pretty much what we are doing in many, many cases. We are providing and feeding into our artificial intelligence systems data that are lacking aspects, that are not complete. In some cases, they're really biased. And this has been mentioned also by Professor Valencia. So I know this is a funny slide, but it's to give you an idea that the vast majority of biomedical data we have accumulated, for instance, genetic data and genomic data, we have humongous amounts of data right now that can be explored. But the problem is that the vast majority of this data we have were derived from individuals that were, in most cases, males, white, of middle age, of middle social class, and so lack completely the variety and the diversity that actually exists in the real world. So if you use this type of data that are basically biased to create any solution for health, you're gonna end up with a solution that will work only for this type of people, but these are really a minority in the entire population. So we are not serving the whole society. And to give you an example that is actually very relevant for COVID right now, in this very nice paper published last year, the authors looked at, this was image analysis of X-rays of lungs, used to train an algorithm to diagnose different types of thoracic diseases. And so the algorithm can do that pretty well. And actually, I'm as excited as Professor Valencia. I think that eventually algorithms will be doing this instead of doctors, and way better than doctors. But there is a caveat, because you have to start with a good data set. So what this group actually did was to check what was the effect of having biased only males, only females, or different proportions of males and females images in the data set that was used to train the algorithm. And they could actually show, mathematically, really with numbers, that it makes a difference, that there is kind of a sweet spot. If you go below a certain threshold and you don't have enough, let's say, male images in your algorithm will really struggle, and will have low performance in identifying and diagnosis and disease in male, because it was lacking the information to begin with. So this is really an important point to consider. Now, sometimes you can go back and fix the problem of your database that is biased by acquiring new data. Sometimes you cannot, so it's really not easy. And I think it was a great merit of this paper that we published in collaboration with the Barcelona Supercomputing Center. That was, I believe, the first paper, the first review to provide a kind of a big picture of what this issue is and the different aspects to it and how complex and important this conversation is. So again, it was the point of the paper, which I think is extremely important, is to highlight that there are different types of biases that you can have in your data set, historical, representation, measurement, and you must be aware of them. Some types of biases, most of them, you might want to remove or at least be aware of them and either remove or implement mitigation strategies to reduce the effect. Some other biases in terms of the actual differences between men and women, that's something that you want to have and to represent in your data set. You want to be aware that there are differences between men and women, as well as, you know, according to sex, to age, to ethnicity, this type of specific individual characteristics, and being aware of them is actually important to keep that in mind while developing novel solutions. So I think with this review, we really put forward these concepts in a very comprehensive way, and I hope this will have an impact on future development of technologies. So a few slides to summarize what we do and what is really our call to action based on all this. I'm here representing today a very big group of people, the WBP. We are a group of scientists, but also experts from different disciplines. We have experts in exponential technologies, in pharmacy, in communication, psychology. We have patients and caregivers also contributing to our team. So it's a very diverse team on itself and very motivated and passionate. So it's a privilege to be here representing the whole group. What we do, so this is a non-profit organization. We study sex and gender differences as the gateway to precision medicine. We work on creating evidence, establishing our expertise, and especially creating awareness on these topics, both with the experts, but also with the lay public. And our overarching goal is the creation of a sex and gender precision medicine institute in Switzerland, which is a project, a very ambitious project, which is in progress. And stay tuned for some news on this soon. Our call to action, so we're extremely passionate about the topic of sex and gender differences, especially with novel technologies. And I would like to leave you with 4 points that are our really call to action. First of all, the most important thing is that we need to analyze and to characterize and to quantify and to know the sex differences from a scientific standpoint, from preclinical studies to drug development to the novel technologies. At any level, we must analyze them. And once we know what they are, we have to raise awareness on it. So everybody should be aware that these differences exist, because we have to think of ways to implement these differences, to leverage them, to improve the solutions that we are creating. And this has to happen at every level, so from the scientific community to actually policymakers. Of course, we will have to find together solutions and implement solutions that improve the data analysis and the drug development to make sure that we detect bias when we have it. As much as possible, we eliminate bias, and when that is not possible, we mitigate bias. So we must have an open conversation about this and find innovative solutions there. And finally, I think this is particularly important to say once again, is that we must incorporate ethical considerations during every stage of technological development. So once again, we are at a historical moment where we are creating today the technologies that will be the basis, you know, the everyday life of medicine in maybe 30 years, even less than that. We are creating it today. I think it's historical. I feel privileged to be witnessing this. So we have a chance to do it. We have to try and do it right. So we have to have these serious and difficult conversations about ethical consideration, about the biases, about how to really implement solutions that can benefit everybody, the well-being and health of the global population. And it's our responsibility to do it now to avoid having later on solutions that, again, propagate bias and do not help the whole community. So this is our call to action, and I think actually this series, this initiative, spearheaded by Bioinfo for Women, it's actually a great initiative in this direction to raise awareness and to start this conversation and discussion, so kudos for that. I'm happy to take questions, and if you want to follow us on social media, we are present on several platforms. Feel free to reach out also via email, and thanks again for your attention.
Gracias, María Teresa. Ahora ya, después de estas dos...
Thank you very much, Maria Teresa. After these two very interesting presentations, Valencia's and yours, let's move straight into Q&A. Is there any question from the room? There's one at the end of the room. Now we will need a microphone.
Empezamos con otra mientras traen...
While we look for the mic, we'll see if there's any other question in the chat box. Here's a question that I cannot listen, unfortunately, because they are not using the mic. Well, if it's for you, we'll repeat it. Here comes the mic, sorry.
Se me oye.
Ahora sí.
¿Han tenido experiencias de investigación?
Have you had any research experience in which you have perhaps insisted too much in the gender bias and this has ended up having a negative impact? Well, from my perspective, as I recall, no. I don't think there's an article ever or a review that has been criticized for placing too much importance in the gender difference. And the literature in the field is extremely vast. So it's quite remarkable. As far as I know, no, there has been no case. I recall many examples that of the contrary, where articles have had to be, let's say, replaced because they had a negative gender bias in the sense. Maria Teresa, would you like to say something? Would you like to reply to the question, sorry?
I agree with you, and I just would like to add that in my experience, when we started with the Women's Brain Project, I thought it was super interesting, so I started to talk to a lot of scientists and researchers about it and asking, have you ever checked differences in men and women in your data set, in your results? Have you ever done it? And at the beginning, there has been a lot of resistance. So the response that I was getting 4 years ago was like, why should I? What's the point? It's kind of a waste of time. That was the attitude. But that has changed. And right now, the scientific community, at least in the field where I work the most, in Alzheimer's, but also in other fields, has really understood the potential of this in terms of understanding the pathology, even put very simple in terms of publishing papers. I mean, there is really a lot of research possibilities. And so I think the attitude towards this has changed, and now there is quite a lot of interest in researching and publishing in this, which I think is good for everybody.
Bueno, profesor Alfonso ha comentado.
Question for Professor Alfonso. You said that companies such as DeepMind have a super incredible computational capacity, right? So probably there will be a bridge, there will be a gap rather between the private and the public science, and this is a risk, and this is related to the computational capacity. My question is, what about the quantic computational capacity? Probably there's even a wider gap in the quantic computational capacity because all companies investing in quantic computational capacity are private. In the Barcelona Supercomputing Center, is there any perspective to overcome, to rather shorten the bridge when it comes to the quantum computational capacity gap? Thank you. Wow, that's an interesting question. First of all, we're not so sure about how long it will take, and there are very heterogeneous opinions regarding when we're going to start having real implementations of quantic systems. It seems like there will be specific methodologies or implementations that is in the quantic domain, But when it comes to general quantic machinery, this is something still quite far away. Programming at the quantic level is not the same as programming with computers. So this is still far. Of course, as we get closer to this hypothetical future, as we implement more expensive technologies, be it in the medicine field or in the computational field, the risk of having social gaps is wider, is bigger. Of course, up to recent, medicine was generalistic, right? Cancer was treated equally everywhere. But as treatments become more and more tailor-made and personalized, we have to think about in which hospital is the best treatment for what patient. Of course, this means that there might be a social gap. Not everyone will have access to certain treatments, so we need to avoid that. And the same applies to the computational domain, right? As it becomes more expensive to do computation, and the example of Mare Nostrum is the same. The investment is immense to compete, and if you want to be there, you need to invest more. And of course, more is not a little, but a lot. You need to be competitive, and that is expensive. Of course, there are plans to try and shorten this gap, this potential gap. There are national plans, and we'll see how it works. Union recovery funds see what extent or what amount of this money will be invested in these technologies, and let's see to what extent we can jump forward in the implementation of quantic systems. Definitely the BSC is super interested in being part of the process. If we're capable of investing, we'll be more competitive, and if we're more competitive, probably we'll be at the global debate. Now, thinking about how quantic computational methodologies will be used to develop algorithms in precision medicine or in machine learning is still rather tricky. We know very little regarding quantic computational mechanisms. There's a very short list of algorithms that will be, let's say, capable of operating in the quantic domain in the upcoming years or even decades. From our perspective, the question is excellent, but still we don't know. Of course, technology can end up provoking gaps. We need to invest in technology if we want to be in the global debate. The quantic technology is one interesting technology, but the implementation, the implementation of quantic technologies is still far away. I don't dare doing a forecast in the sense. There's one more question here in the chat box. So the gender bias is the result of a women political struggle. What is the relationship between science and the political paradigm where it operates? How can or how should bias be identified? I'm not sure I understood the question. Doctor says, can you read it again a little bit slowly, perhaps? Okay, the question goes. There's a statement first. Gender bias stems from a political struggle, from a feminine political struggle. This is the statement. What is the relationship between science and the political paradigm where it operates? Who or how should gaps or bias be identified? This is the question. Well, science does not operate in a vacuum, that's for sure. Scientific outcomes tend to be objective, but the science that generates outcomes is not necessarily objective. We need to be careful of that. Of course, science happens in a social environment with social limitations, and oftentimes problems that science tries to understand are the result of a social process. Today, due to sociological realities, complex sociological realities are aware of a problem that we had no awareness about in the past, related to the gender bias. And this is positive awareness, I mean, because only when you are aware of a problem, you are capable of starting remedy it and start working to overcome such gender bias and others. Of course, in other political or social environments, solutions would look different than here. From my perspective, as a citizen and as a scientist, I would like to say that I hope we preserve a social environment where our concerns for social equality are at the center, and not only because it is ethically desirable, but also because the outcomes will be much better for us all. So the answer is probably yes, depending on the context where, I mean, if you are in a fascist state, science will look very different and it will be limited to very specific parameters, and probably the gender bias will be the least of the concerns. But if we are in a reasonably democratic environment that places equality more or less at the center, or at least in the debate, science will work to try and solve such problems. María Teresa, off you go.
María Teresa, ¿alguna consideración sobre la pregunta?
Would you like question as well?
I had a comment to it. I'm not sure it's an answer to the question because I can't really comment on the political side so much. But I wanted to highlight actually how important it is to have this type of diversity at the policymaking level. So political in general, but I'm really thinking policymakers in global health. And this is a topic that has been raised during the COVID pandemic, so that there are a lot of sex and gender differences. There are a lot of specific struggles for women at several levels, and some specific for men too, but issues for women working with families, with kids, the side effects, the lactation, the pregnancy, and somehow we haven't really tackled them, and there is a general consensus that we lack women in the policy-making positions. I think in the ideal world, anybody, men and women, should be sensitive to this topic and should be pushing for this type of equality and avoiding gender gaps at any level. But it is true that having more diversity right now, having more diversity among the policymakers and the decision makers, I think it would implement change. It would be a driver of change, and it will for sure increase consideration of these sex and gender differences at multiple levels. So that's what I'm personally hoping for the future.
Gracias. ¿Alguna pregunta más en la sala?
Other last burning question in the room? No? What about through streaming? Well, I have a question for you, for both of you actually. So how do you see, let me start again. What do you think, I mean, what role do you think cities will play in the process? Barcelona, Zurich, are cities involved? Are cities engaged in the process? Well, I would say that today, when sociologically we are experiencing a very important difference between cities and non-cities, let's say, and between cities and the environment, the countryside. So there are cities which are very active, like Barcelona or Zurich, that play a very important role, especially due to the social environment where we operate. As you have already said, in Barcelona there are a long list of circumstances. We have top hospitals in Europe, we have Barcelona Supercomputing Centers, which are amazing as well, of course. I cannot say otherwise. We have an important accumulation of biomedicine scientists, especially supercomputation scientists, and all this plays in favor of Barcelona as becoming, hopefully, a hub of personalized medicine and AI implemented to PM in the future. We are an active city, we are in an active city, and I believe that all these developments will happen in a fight against gender bias. I believe that the combination between an activist city, because Barcelona is a concerned city, is an engaged city, so this combined with an important technological and scientific network, well, it makes it a good platform for Barcelona to lead a change, or at least a struggle towards a better society. María Teresa, what about Zurich? What is the role that Zurich is playing in this change, in this process?
Yes, I have to start by saying that I'm a big fan of Barcelona, so I think it's absolutely amazing what the city is doing right now on multiple levels, and this is one of them. Zurich and the Switzerland in general, but Zurich and Basel in particular are extremely active. They are hubs of innovation. They are hubs of novel technologies and novel ideas, and it's for sure is no coincidence that our group has somehow has been created in Zurich because of the combination of researchers, like you said, in Barcelona, so researchers, top-notch hospitals, the innovators, technologies, everything in one place. So it makes a difference for sure. And I am a big supporter of the idea of innovation that and really disruptive ideas that come from small groups. And I think the Women's Brain Project is actually an example of that. So I think you can start at the local level, creating awareness and creating a nucleus, of change. And this, if done, it has to be done the right way and at the right time as well. But I think it has the potential then to have a snowball effect. So I see Barcelona and Zurich as potential snowballs that can then drag the rest of Europe and eventually the world in this process of innovation.
Muchas gracias.
Thank you very much for your remarks. Shall there be no more questions? We are getting to the end. So we're going to leave it here, not without saying that it's been amazing. Thank you very much. Thank you very much to all of you, and you are all invited to the following session in April 14th. In this case, we'll have a workshop. I can't remember the title anymore. It will be on medicine and health. We'll have 4 amazing speakers also on April, and we'll have a workshop and an open discussion with researchers, scientists, NGO representatives, companies, and other civil society organization entities. Thank you very much. Good evening, and bye-bye.